So I know a lot of you have been talking about this new study that just came out with gabapentin, so I'm going to try to give a quick overview of it today. So this study was a retrospective cohort study, which means they looked back at patients who had received a diagnosis of low back pain and had either been prescribed gabapentin or not been prescribed gabapentin. And then they looked to see if over the next 10-year period, if those patients had received a diagnosis of dementia or mild cognitive impairment. It included over 26,000 patients. They found that in the group that had received 6 or more prescriptions of gabapentin for their low back pain, they were 29% more likely to receive a diagnosis of dementia over the next 10 years and 85% more likely to receive a diagnosis of mild cognitive impairment than patients who had never been prescribed gabapentin. So how do we look at studies like this? So the first important thing is to look at the type of study that it is. It's a retrospective cohort study, which means we can see correlations, but we can't infer causation. That means we can't say for sure that the gabapentin caused the dementia until we do a randomized controlled trial. But it does tell us that we need to do one because there could be a signal there. So a good example to explain why we can't infer causation here. So there's a higher risk of suicide in teenagers who are on SSRIs. Now, one could say, well, the SSRIs must be causing people to commit suicide. Well, that's not the case. It's that teenagers who have depression are more likely to commit suicide, but they also are prescribed SSRIs. So a randomized controlled trial helps us find out, is it actually the gabapentin that's causing the increased dementia risk, or could it be other things like the chronic pain itself? So how do I look at this study? First of all, I don't prescribe gabapentin for chronic low back pain. I respond it for neuropathic pain diagnoses because that's what it's best at treating. The second thing is I do think it's important for us to look deeper at this. We need to do a randomized controlled trial so that we can appropriately counsel patients about whether there's a risk or not. I have a really close family member who's taken both gabapentin and pregabalin over the past 3 years, and he's found it very helpful for him. But I know that this is a complaint that a lot of patients have, that it makes them cognitively not feel as sharp as they were before they were on the medication. So I think it's important for us to do the randomized controlled trial, but it's also important to prescribe the medication for things that it can actually be beneficial for, rather than just giving it to every single patient. So I hope that helps give a little clarity, and if you've got any questions, leave them in the comments.